You are live, doctor.
Good morning, Dr. Ara Deukmedjian with the Deuk Spine Institute, and we are here today to cure back pain in a patient who's traveled from Texas, right? You came from Texas, right? All right. And the reason he's here is he wanted to have the Deuk laser disc repair. He recognized this is the least invasive surgery available to cure back pain, and he came from Texas here. We have a lot of patients who travel from out of the country or out of the state because this treatment is not available elsewhere. You got to lay still, okay? Now, our patients are always awake in the beginning of surgery, and we're going to put him to sleep once we get to where we need to be. But I need to gain access first to the disc. So he's a little jumpy, so I need your help. Otherwise, we're going to have a lot of problems with blood pressure and movement. So maybe you can give him some sedation, help him relax a little bit. I don't know why local injection is not working, but he seems to feel this, which he shouldn't. It's a little bit better. All right, so we start out with our patient awake to help me because I need to navigate from here outside to the area where the pain is coming from. And back pain comes from herniated discs, specifically in the back of the herniated disc, this area in the foramen, the neural foramen, where there's a tear called an annular tear. And all discs have the same structure. They have a jelly center called the nucleus pulposus. It's very watery, very gelatinous. And then they have something called the annulus fibrosus, which is like a ring of tough tissue. If you've ever eaten steak and you know there's a rind around the steak, this really chewy, collagenous tissue, that's what the annulus is like. It's very thick and full of collagen. So the annular tear occurs in the back of the disc, and what that does is it allows, let's go to a lateral. What it does is it allows the jelly to push through the tear in the back of the disc. We have a nice video animation we're going to show you right now. Go ahead and run our video animation,
Yes.
what causes chronic back pain, and show them how the annular tear becomes inflamed. And then that
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain.
are far more invasive. There's more blood, there's more yelling, there's more
The inflamed annular tear generates pain signals.
But we are going to show you our entire surgery. So you may see some things that bother you, but you know, in reality, this is live surgery that we're streaming. So we're here to stream it so you can learn. Just cue me when they're ready to hear me. Jordan, I need you to get this right. You're taking too long. I don't think he's got a lot of scoliosis or anything. You can see when you have a WAG issue at 5. You're probably about a degree off. Oh, you went the wrong way. Look at the iliac crest, the top of the iliac crest. See how they separated more? You went the wrong way. So go back 2 degrees the other way.
Pressure on the disc causes herniation of the nucleus pulpus through the annular tear.
Video's almost done.
All right, so the WAG looks good.
Inflammatory tissues develop within the annular tear, causing back pain.
That's better. I think the WAG is
You're good.
fine. All right, good. All right, so we're still here trying to navigate down to the spine using the X-ray machine local. And the X-ray machine is really the best way to navigate to the spine. There's no other way that works better. MRIs don't work better. The X-rays are sort of a tried and true technique that we've been using for many years. We gave a little more local, about another cc. Watch the needle. Anything you can do to help me would be appreciated. Shot. Lay still. All right. So just making our way down to the disc. And he has a pretty high iliac crest. Shot. Shot. L5-S1 is always the hardest disc to get to. Shot. You're doing good. All right, let's go AP. See where we are. Don't move too much. You're doing great. So everybody has a different pain tolerance, and the patient has to be awake for this part. So what we're trying to do is balance his level of sedation and comfort with the need to feel pain. Because what I need is I need him to tell me if I'm getting too close to the nerve root that we're going right past, which would be the L5 nerve root. Shot. All right. Shot. 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 How's he doing? Shot. I think I'm where we need to be. Let's go AP and just see. So I'm accessing that's the L5-S1 disc that we're going to, and it's the back of the disc. And it looks like we're coming straight in through the back, but we're not. We're actually coming off to the left side. And the reason we're on the left side, it's perfect. Let's go back to a lateral. The reason we're off to the left side is because the patient has left-sided pain down the left leg. We always do our lumbar Deuk laser disc repair for lumbar disc herniation and disc bulges based on the side of the leg pain. If the patient doesn't have leg pain, then we go based on the radicular symptoms, which is numbness, tingling, weakness in the leg. And if they don't have any of that, shot, then we go based on which side in their back they have pain. Shot. That looks pretty good. Maybe a little bit lower than I want to be. Shot. All right, so I need to come up a little bit. What I'm hitting is the superior end plate of S1, which I don't want to do. Still hitting it, shot. Shot. How's he doing? Is he reliable to me? Shot. I'm just a little bit lower than I want to be. Shot. Shot. Yeah, I know. Where's your bad disc? Give me an AP view. Let's verify that we're in the right place. All right, so you've watched the video now on how the Deuk laser disc repair works. You could see that the problem is actually a tear. Perfect. There's a tear in the back of the disc, and that's the source of the back pain, the tear. And unfortunately, Deuk Spine Institute and myself, we're the ones who discovered the source of back pain being the tear, and most doctors don't know that, so they're not going to be able to tell you where your pain's coming from. So it's a new discovery. So if you go to the millions of doctors around the world that are treating back pain, they won't be able to tell you it's coming from the tear because they don't know that. We're trying to get the word out, and that's why we live stream our videos, is so that people can learn about the source of chronic back and neck pain and thoracic pain is the tear. It's called the annular tear. And again, it was discovered here at Deuk Spine Institute years ago, and we've been trying to spread the word. Shot. I think you're a little too far south. There you go. You must have moved north a little bit. And we've been trying to get the word out so people can learn about it. These surgeries we're doing, we're literally only fixing the tear and removing the herniation. Yeah. So his blood is, he must have been on some type of an anti-inflammatory, because this is more than just blood pressure. I don't think that's the case. There's something else he must be taking. Shot?
Maybe some of the herbals he takes. He takes a lot of herbals.
Yeah, it's the herbals, I'm sure. Shot? Is he awake? Huh?
Yes. Felix,
Shot?
are you feeling that?
All right, let's go AP. So herbal medications tend to thin the blood and make it bleed. It makes the blood more watery. You don't get the platelet plug. They kind of block the platelet plug, which is the first step in clotting. Let me know when you're going to take a shot. Go ahead. All right. The good news is it's superficial bleeding usually, but we do have to go deeper, so we want to make sure nothing is going to happen deeper. Shot. All right. So we're heading for the L4-5 disc. Today our treatment is going to be the L4-5 and L5-S1 discs. Shot. And so that's where I'm headed to. Shot. 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 Where do you feel that?
Where do you feel it, in your back or in your leg? Back.
In his back. Just lay still. I can't have you moving around. Shot.
Stay still. Keep your head down, Felix, okay? Just
Shot.
one more minute. We're almost done.
Shot. Where do you feel that, Shot? Huh?
I went to the leg.
How far down?
Down to the feet.
Down to the feet? All right, so I need to get a little bit more medial. Lay still. Shot. Shot. So we're aiming right for that facet joint at L4-5. Shot. And then we're going to go just past it. Shot. And you can see the L4-5 disc just in front of the facet. Shot. And that's really our target. Shot. Where do you feel?
In the leg? Yes. In the leg.
No.
Pardon me?
How far down? How far down? We're not even near the nerve root. How far down?
To the foot.
Right now. That's where he feels it?
Do you feel it in your foot now? Felix? You don't feel anything now? Okay.
He must have been compressing his disc. Interesting. Like tightening up his back, squeezing the disc backwards, hitting the nerve root. Are you better? All right, shot. All right. Shot. Where do you feel it?
Okay. No, Felix. Tell me where you feel it. Just stay still. Where? The back? And the leg?
How far down your leg? AP.
Where? How far down your leg? Nothing in the leg.
Nothing. All right, that's good. All right, we're almost done. You're doing very well. So we're right on the facet. at L4-5. Let's go back to a lateral view. We're going to be able to put you to sleep soon, okay? Just relax. Shot. I need you just to relax, okay? Where do you feel it?
Where do you feel it, Felix? In the leg? A little bit in the leg. Keep your head down, Felix. Stay still.
Shot. All right, are you better? Okay, we're going to put you to sleep soon, okay? Just relax. All right. So, there's only one test in the world that will tell you if a herniated or bulging disc is causing someone's back pain. It's called a discogram. And normally we don't do them because they're invasive. As a matter of fact, when you do a discogram, it looks identical to what we've just done, except for the last part of the discogram, which we're going to do in a minute. Now, he has 2 herniated discs on his MRI, right where his back pain is. And when I asked him where his back pain was, he pointed right here, okay? And there's 2 discs on the MRI that are bulging. Now, a lot of people are confused about bulging discs versus herniated discs. And I'm going to tell you something. There's no difference. A bulging disc is a herniated disc. There are literally 10 different names for a herniated disc, and some are used more commonly than others, like prolapse disc, bulging disc, herniated disc, ruptured disc, protruding disc, extruded disc. All right? So there's literally many names for the same thing. And in the end, those names are totally inconsequential. They mean absolutely nothing. And honestly, you know, the medical community has made such a big deal about all these different names, not really understanding that they're really all the same disease, same problem, okay? So, the source of pain in a disc injury, like a herniated disc or bulging disc, is a small tear in the back of the disc. And again, we discovered that is the source of the pain here at Deuk Spine Institute. There are doctors that have known that herniated discs cause pain, but no one really knew how or what part of the disc. And there's a lot of people who have theories, like it's a slippage of bones or bone on bone, but it's not. Slippage of bone, bone on bone, scoliosis, none of those things cause the back pain. What causes the back pain is a small tear. And again, that was discovered at Deuk Spine Institute first. So because we discovered it, we have to get the word out. Now, how do we know this? The reason we know this is because I've been fixing these tears now for 15 years. And when you fix the tear with a laser, literally the pain goes away. The back pain goes away, the neck pain goes away, thoracic pain. Whatever the patient's pain is, whether it's back, neck, or thoracic, it literally goes away completely with this procedure. So, like I said, one thing we like to do is to test the discs before we do surgery to verify they actually cause the patient's pain. Are you comfy?
Felix, are you comfortable? You okay, Felix?
Let me know when he's responsive.
Yes, he said yes.
All right. First one we're going to test is L5-S1. How bad is that on a scale of 1 to 10?
What is it?
What's the highest it went?
8.
Huh? 9? All right. So is that where you typically get back pain? So, yeah. All right. That was the first one we tested. So, yes, that pain will be gone forever when we fix it, okay? As long as you don't re-injure your disc. So right now he just confirmed for me that the bottom disc, L5-S1, is causing 9 out of 10 pain with that test, and that it's his typical pain. Now, the severity is not as important. You know, yes, 9 out of 10 is a big deal, but what's more important is that it's his typical pain. We call that concordant. How bad is that on a scale of 1 to 10? Huh? Is that where you typically get back pain? All right. Great. So we get to put you to sleep now. Okay? You're going to go to sleep. Can you count from 1 to 100 for me? Out loud. What's your natural tongue? What do you speak normally? Huh? Oh. All right. So count in Tagalog for me. I like to get people to count in their native tongue. It's kind of interesting. It just shows how the seeds of the trees have traveled in the wind and have spread around the world, how interconnected everyone is in the world, you know? So, all right. So what do we just do? We just proved that those 2 discs that I'm fixing are causing his back pain, the typical pain he gets. And one was an 8 out of 10 at L4-5, the other one was a 9 out of 10. And now he's asleep, so we can actually get started on the surgery. The first disc I'm going to fix is the bottom one, L5-S1. The most common disc to herniate and cause pain is L4-5. The second most common is L5-S1. The third most common is L3-4. So you can see the incision is 7 millimeters. The whole surgery will be done endoscopically through a 7 millimeter incision. Shot. Now I have the guide wire in, and I'm going to take my needle out, okay? The blue stuff is the dye we use here at Deuk Spine. It matches our colors of our company, which is royal blue. And the reason we use the dye is to stain the degenerated disc material, which is actually nucleus pulposus that has come under the action of inflammatory cascade of the human body. So whenever nucleus pulposus gets attacked by the inflammatory system, like it does with a herniated disc in the annular tear, you're going to get a degeneration of the nucleus, and it becomes acidic. Okay, acidic, like an acid, very mild acid. And that acidic tissue basically binds to indigo carmine dye, which is the blue dye we use. Shot? Now we also use a dye that allows us to see on the X-ray, and it turns dark, and that's why you saw the dark dye in the disc space. That's actually a dye called omnipaque. So we do a mixture of omnipaque, indigo carmine. Shot? All right, so we're getting to where we need to be. Shot? And I can tell you, it feels like there's a good sized disc herniation and tear here. Shot? Again, this is L5-S1. Shot. All right, I'm going to take out the guide wire. Leave that. Yep. So we're going to advance this tube into the L5-S1 disc space. And this is where the patient needs to be asleep, because remember what I told you, it's the tear in the back of the disc that we just passed through that tear right now with the dilator. That tear is the source of the back pain. So it's very sensitive. The reason it's sensitive is it's inflamed. Have you ever had inflamed tissue in your body? You know, whether it's a really inflamed pimple or some other inflamed tissue, it's really sensitive, very tender. Sean? So now I'm bringing the tube that we're going to do the whole endoscopic surgery through this tube. I'm bringing that in. I'm advancing it into the disc. Shot. And I'm going to repair this disc through this tube. And for those of you who have never seen this before, which is going to be many people, I'm sure, this is endoscopic spine surgery at its finest. So the whole surgery is done through a 7 millimeter incision in the skin and a 7 millimeter tube. Okay? How could we possibly operate through this tiny little tube? You all see this tube here? It looks like a shake straw. And the way we operate through this tube is endoscopically. Now there's a lot of scammers out there that talk about doing laser surgery and endoscopic surgery, but they really don't. So you want to know what endoscopic surgery looks like? This is it right here. This is, you see this, Diego?
Yes.
This is an endoscope right here. Okay? It's FDA approved. We have an irrigation source. We have a light source. You can see the light source. And we have a camera, high definition. By the way, did we find some more of these?
Yes, sir.
Good. We're getting them
$5,000.
each? Okay.
Cheapest one.
Let's get them. A reputable company, warranty. Good. And they're the right one, right, for our model?
Yeah, the same.
Perfect. Yeah, let's do it. All right. So this is a true endoscope, and this is true endoscopic spine surgery. And all of this is done with a single port. We call this a uniport or one port. There's a big push right now in Europe and all over the world to do biportal surgery. There's no reason for it. You don't need it. My results here are better than any endoscopic surgeon in the world. I challenge any endoscopic surgeon in the world or any spine surgeon in the world. There's no one that has a higher success rate of curing back pain than we do here at Deuk Spine Institute with these surgeries. Basically, our patients are at 100% elimination of their back pain. And if you took the average, it's somewhere around 99%. So let me have a grabber. Now we've looked at our patients that had this surgery done and studied them 5 years later. And for the people that had the surgery done and 5 years later, they still have 95% relief of their back pain. 95%. That's incredible. So there's no other surgery in the world that gives patients 95% elimination of their preoperative back pain from the discs than the Deuk laser disc repair. Laser? All right, so there's the tear. There's a lot of inflamed tissue. I want you to take notice of this. This is a great picture here, okay? Let me see if I can clean it up a little bit and make it a little bit more, less blurry, a little more resolved, they say. I want you to look at the color of this tissue. This is very important. Yes, there's a little bit of blood clot at the bottom at around 7 o'clock, okay? Don't pay attention to the blood clot. Look at the actual color of that tissue right there. Can you see a pinkishness to it? That pinkishness is granulation tissue, inflammatory tissue within the annular tear. That is the source of this person's pain. And the reason why it hurts so bad is it has little nerve fibers in it, what are called naked type 4 class C nerve fibers, which are pain fibers. And these pain fibers take electrical impulses from this area, signals, pain signals, and transmit it to the brain. All right? So why don't you run the video one more time on the cause of back pain, the cause of back pain video, showing the audience the annular tear, which is this right here, how it's red and inflamed. That's what this is. This is the red inflamed area within the annular tear in the back
Traumatic
of the disc
injury
called
to the
the
disc can
posterior
cause
tear.
annular tears to form.
That is the source of all the pain. And once you're done running that video, let me know when you started.
Yeah, it's
Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Traumatic injury to the disc can cause annular tears to form.
Get started with the laser, and we're
Pressure
going to
on the disc
basically
causes
zap away
herniation
this
of the nucleus
painful
pulpus.
tissue. And once this tissue is gone, the patient will be out of pain. No more back pain. Gone. How do we know? Well, I've done this over 1,300 times, actually in 1,300 patients. And we always get rid of the pain every single time. from the discs, okay? Are there other causes of back pain besides a herniated disc with inflammation in the annular tear? Yes, there are. There's piriformis muscle pain, which is lower down in the buttocks. There's sacroiliac joint dysfunction pain, where the SI joints are inflamed and people have pain in the SI joint, sacroiliac joint. There's pain from the facet joints. Those are typical degenerative sources of pain, but the disc herniations are the number one. And this surgery works for degenerative disc disease. It works for bulging discs. It works for herniated discs, because they all cause pain the same way, inflammatory tissue that we just saw, the pinkish stuff. This is all scarred tissue from chronic inflammation. It's very thick, very abnormal. Little bit of nuclear material still here, the blue stuff. And then we're going to go lateral and zap this stuff as well. Any questions from our audience?
Yes, we have one question. Where did Dr. Deuk go to school?
So again, your voice always trails off, Diego. You have to maintain a high volume
Can
while
you-
you finish your sentence.
Can you hear me well right now?
I hear you, but you kind of trail off with your voice.
Okay. The question is, where did Dr. Deuk go to school?
Where did Dr. Deukmedjian go to school? Great question. So first of all, I want you to know there's a little bit about the history of the Deukmedjians, okay? My father came from Egypt, from Alexandria, to the United States in the 60s during the Vietnam War, and he basically served in the United States military, and I was born in Germany. And my brother, and the reason this is important is because when you say Dr. Deukmedjian, there's really 4 Dr. Deukmedjians. Actually, one is now a Dr. Schrumpf, but there's Dr. Armin Deukmedjian, my brother. There's Dr. Ara Deukmedjian, my father, and there's Dr. Ara Deukmedjian, who is me. So when you look up on the internet or PubMed, you'll see that all of us have published papers in our careers, which is a great achievement to be able to publish findings and discoveries in medicine, okay? And my father was an obstetrics and gynecologist, so he published in OBGYN. My brother is a neurosurgeon as well, just like me, except not as good looking or smart as I am. And he's in Tampa. So when you look up Dr. Deukmedjian, you got to know which one you're talking about. That's the only reason I mentioned that. So you know that there's more than one of us. Now, I did my undergraduate at the University of California, San Diego, UC San Diego. At the time, the average GPA for UCSD to get in was a 4.2. And it's an incredible school. And I learned a tremendous amount there. I couldn't speak higher of it. Unfortunately, if you look at the U.S. News and World Report rankings, it's not like, it is up at the top, like top 20, but it's not number 1 or 2. But I don't really agree with those rankings at all in terms of quality of education. I think there are better schools than those that are ranked at the top of U.S. News and World Report. I think it's more political and possibly economical, financial. There could be financial incentives given to U.S. News and World Report to rank the schools. So of course they show you what they rank by, but it's all subjective basically. But UCSD, I would go back to in a heartbeat. Incredible school, great education. If you know what a GoPro is, the founders of GoPro went to UC San Diego, graduated from UCSD, I think around the same time I did. So great school. And then after UCSD for undergraduate, I ended up at University of Southern California, USC, for medical school in Los Angeles, USC. The Trojans, if you know who the Trojans are. And USC at the time was a 120-year-old school, medical school. So it's a very old medical school. It's been around for a long time. Incredible education that I got there. And honestly, I worry all the time about the quality of education in medicine, that it's deteriorated. I look at the surgeons trained today, and I don't think they're better than the surgeons trained yesterday and years ago. I think they're worse in many ways, unfortunately. I think the outcomes of surgery are worse. So I'm very concerned about the medical education going on at the universities. But USC, Los Angeles is where I did med school. And then I did my neurosurgery residency at the University of Florida in Gainesville. And that started in '97 and ended in 2004. So that was 7 years. At the time, University of Florida, Gainesville was considered the best neurosurgery residency training program in the United States. And the reason I know that is my mentor at USC, his name was Dr. Marty Weiss. And Dr. Marty Weiss was the chairman of USC Neurosurgery, which was one of the top neurosurgery programs in the country. And Dr. Weiss was also the chairman of something very important called the Residency Review Committee. So the Residency Review Committee is the board of neurosurgeons that travel around the United States and world, and they literally sit down and review neurosurgery residency programs and accredit them. They give them their accreditation or take it away if they're not doing a good job of teaching neurosurgeons. So Dr. Marty Weiss was the chairman of that committee for many years. And he was the chairman when I was a when I was a student in medical school at USC. And he basically sat down with me and personally ranked the best neurosurgery programs in the country. And number one, he put University of Florida with Dr. Albert Roten. He thought the world of Dr. Roten. He thought he was an incredible neurosurgeon and leader and chairman. And so he told me better than USC, his own program, was University of Florida in Gainesville. Now the program has undergone a lot of changes since I graduated in 2004, and there's new leadership there, and I don't think the program is as good. Not at all, not even close. So I don't think University of Florida is a top neurosurgery training program anymore. I think it's had a deterioration of quality of training over the years. Dr. Roten retired and subsequently passed away. Dr. Arthur Day, who was one of the top cerebrovascular neurosurgeons, was my faculty when I trained, and he moved on and became chairman at Harvard Neurosurgery, and then eventually went back to the South where he's from in Louisiana. And Dr. Rick Fessler, one of the top spine surgeons in the world, went off and became chairman in Chicago, I think. So, you know, we lost him as well. And then Parker Mickle, one of the top pediatric neurosurgeons in the country, retired. And so the people that have replaced these doctors that have left or retired, in my opinion, are not the same caliber. And therefore the training is not at the same level. So I feel that the program has really, unfortunately, it's suffered tremendously as a result of a loss of great faculty. So what's the best neurosurgery training program today? I honestly don't know. I couldn't tell you. My brother, who's also a neurosurgeon, trained in Tampa at the University of South Florida, USF. It's a good program. He practices over in Tampa as a neurosurgeon. He does spine surgery as well. So if you're looking up Dr. Deukmedjian online, you may find my father as an OB-GYN, you may find my brother as a neurosurgeon, and you may find me as a neurosurgeon. But the Deuk Spine Institute was founded by myself, and this is where you want to go if you want to get rid of back pain and neck pain. I could tell you more about myself if you want, but it would just sound like bragging, and I don't want that to be the case. So any other questions from our audience?
Yes, someone is asking, what is the expected recovery time for this procedure?
What's the expected recovery time? 1 hour. After 1 hour, this patient is going to go home, and by tomorrow, they're back to a normal life. Literally a normal life without the back pain, without the leg pain. They could go to work tomorrow, they can go shopping, they can go on vacation, they can travel on a plane, they can go on a cruise, they can do anything they want with the exception of no bending at the waist for 6 weeks. They're not allowed to bend over, pick anything up off the ground for 6 weeks. And of course, I don't want them playing contact sports like football tomorrow. rugby, anything contact, gymnastics, also golf. They really have to take some time off of excessive physical activity and let their back recover, okay? They have to let the back recover. They have to let this disc heal. Look at all this scar tissue here. Literally from here all the way down is all scar tissue from inflammation. That pink thing over there is the end plate of S1. It's called the superior end plate of S1. So all of this is the tear that this patient has, and the body has tried to heal it by forming scar tissue. But you see the pinkish color? The pinkish color means there's ongoing inflammation. See, scar tissue is white, pure white. There's no blood supply to scar tissue. It doesn't have really much blood supply at all, unless it's still inflamed, okay? So mature scar tissue is white and thick and bloodless. But when you see pink in scar tissue, it means it's granulation tissue. It's fresh, young scar tissue. It means there's ongoing inflammation. And you can see this patient definitely has the pinkish color to his scar tissue, meaning that there's ongoing inflammation. And inflammation is what causes pain. Look how thick this scar tissue is. This is totally abnormal. Okay? And the golden color you're seeing, that gold is calcium. Calcification. It's called dystrophic calcification. And your body tries to, whenever you have abnormal tissue and inflammation going on, your body's response is to calcify the tissue for some reason. Just look up dystrophic, dystrophic, calcification. And you'll see what I mean, okay? It's a calcium or like little bone deposits, calcium deposits in tissues that are abnormal, pathological tissues that have been damaged. It's just for some reason, some of these like collagen and elastin and some of these macromolecules bind calcium well. And I don't know why, but I'm sure maybe there's explanations now. But when I was a medical student at USC, they didn't know exactly why it happened. They just knew it happened. So I did graduate number 1 in my class at USC Medical School. 175 students. Fine. So I was a very dedicated student to learning medicine and being really, really knowledgeable about disease and understanding how it affects people and how to fix it, basically. And I really attribute my ability to understand and create treatments that no one else has ever developed, like the Deuk laser disc repair. I attribute it to my education and my passion for learning and improving. Improving treatments for people and diagnoses. All right, what other questions do we have?
No questions, but we have someone who enjoys hearing you brag.
Oh,
They
okay.
said that you're the best neurosurgeon in the world, and she's been listening to you for 4 weeks since her back surgery.
Well, thank you. I appreciate that. So, for those of you who don't know, we do have a free app that we have created for people. It's no charge to download it. It's free to your iPhone and to your Android if you have an Android. And the app really has great content, I think, very useful educational content that Zach and I have developed. And it answers a lot of questions, I think. It's very useful. We actually use it in our practice in clinic when patients come in and we've diagnosed them with a spinal condition like herniated disc. We actually go to the app and we actually select under their app on their phone herniated disc, and they actually can take that home with them, and it creates a profile just for them, and they're able to look at that profile later on and kind of study it and understand what we diagnosed them with. How many times have you left the doctor's office wondering what exactly was my diagnosis? You know, I don't remember what the doctor said. I don't remember exactly what they wanted to do, but with our app on your phone, if you're a patient, you come in, we select the diagnoses, and we select the treatments. This is all scar tissue, by the way. I'm just trying to remove some of it because it's inside of this scarred up annulus. This is the debridement, annular debridement, by the way, that nobody else does in the world. And this is why we cure back pain, right here. See, this debridement is not normally done, okay? Surgeons do what's called a decompression. They take the herniation out, but this is the herniation, but not really outside the disc. This is the bulge part of the herniation. And that's why we say bulging discs are herniations, because they are. The herniated nucleus pulposus is wedged in here, and it's just encased in scar tissue, but it's going to keep causing inflammation because your inflammatory system thinks that it's foreign. It thinks of it as like a piece of metal or wood in your body and doesn't belong there. So when it sees it, when it comes in contact with blood supply and it sees it, your body attacks the herniation. And it's all embedded in here, like in concrete, but it's still creating pain in this area. That's why I'm treating it, okay? That's why the annular debridement we do at Deuk Spine is the key to successfully curing back pain and neck pain. It is the source of the pain right here, all this stuff. Look at how scarred up that is, okay? This laser can melt steel. Look how powerful it is. It melts steel. And yet look at it, how much effort it is to get through this thick scar tissue. All right, we're just about done here. I think we're done. Happy with the results. So besides the app, which is free, you can also get a free MRI review. If you know somebody suffering with pain, we don't charge for the MRI reviews. They're free. We don't even charge for the telemedicine conferences. They're free. Why do we do that? Because we want to help people get out of pain. Whether or not you treat with us or you go somewhere else, it's your choice, but we can still provide you with a second opinion or a third opinion, whatever you're looking for, and help you get out of pain. All right? That's our goal, is to get people out of pain. All right, laser off. Looks good. Bunch of fat there, epidural fat.
Lights on, please.
That's the outside the disc. Actually, let me get the lateral part real quick. Let's get the laser back on. I want to clean this lateral part of the herniation up. You can see the tear right there, still present. All right. So Diego, why don't you run now the video again, what we just did with the laser, the Deuk laser disc
Got it.
repair animation, so people can understand what we're doing here with
Yep.
the laser, with the debridement. All right. Good. It's all a bunch of fat.
Lights on, please. Thank you.
So I'm going to suck the juice out. Scope off. So a little betadine, you know, down the tube. The betadine shot.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. the annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your
Video animation that we created to explain what we do in here endoscopically to repair the disc. We're now taking this tube out. Remember, this is the tube that was at, nice job on the blood pressure, at L5-S1. We're now going to do the L4-5. So I'm going to bring the scope back in. So this patient came to us with chronic back pain, like so many millions of people in the world, hundreds of millions to be exact. Hundreds of millions of people with chronic back pain and neck pain don't know what they can do to cure their pain. They don't believe a cure is possible, or if they do believe a cure is possible, they think it's in the form of fusion or artificial discs. Well, this surgery is next level. This is beyond fusion and artificial discs. And this surgery actually cures the pain, and you can treat multiple levels. Most patients have more than one disc causing their pain. So you really do need to do, on average, 2 discs, possibly 3. But our average is 2.5 discs per patient. And the reason is that in most patients, they have more than one disc herniation causing their pain. And unfortunately, most surgeons only fix one at a time. So if you have a more traditional surgery like fusion, not only are you having an unnecessary invasive procedure, okay, but you're also not going to get rid of your pain because your surgeon's going to only do 1 disc usually. Sometimes they'll do 2, but that means they're going to be leaving untreated herniated discs that are causing pain. You don't want that, because then you're going to have to come back for another surgery. Shot? All right, well, we're getting into the L4-5 disc, Diego. Why don't you run the comparison video?
Yep, got it.
You know, the one that compares lumbar fusion with Deuk laser disc repair.
Yes, sir.
Shot? Am I still live?
Do you want to be? I have it side by side.
Oh, okay, you got the side-by-side going?
Yep.
Yep, I just didn't know if you needed time to cue it up.
No, you're fine.
Shot? Shot. 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 All right, let's see what we got. I don't know. I think we're pretty good right there. Let me see. Go ahead and take the guide wire out. Let me know when you're ready, Diego.
Few more minutes.
And you're showing the side-by-side fusion versus DLDR
Yeah, traditional spine fusion.
with that lady who's a mother?
No, it's just both of the surgeries side by side.
Oh, okay.
Okay, you're back.
Shot. See the dilator move a little? Shot. 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 That's perfect. Let me know when you're back.
You're back now.
Okay, well, I hope you enjoyed that side-by-side comparison, but I do want to illustrate, if this patient had a fusion, he'd be looking at an incision on his back
Deuk laser
about
disc
that
repair,
long.
a
And you
comparison
saw
with
what
traditional spinal
involves,
fusion
cleaning
surgery.
out the discs, putting in plastic cages, screws and rods. Think about that. That surgery, the fusion, will take this patient probably 6 weeks to 2 months to kind of get back to somewhat normal, walking around, going to work. At least 2 months. Some people never make a
Deuk
full
laser-
recovery. But the laser surgery, look at this. Would you rather have screws and rods and cages and meat and potatoes, or would you rather have this tiny little cut, minimally invasive surgery where you're going to go home an hour later? It's obvious, right? And for those of you who don't know, that we do all of the types of spine surgery here at Deuk Spine. We could do any surgery. We're capable of doing any surgery here. Our focus is degenerative spine, so we don't do tumors and infections and too many fractures, but we do mostly disc problems like degenerative disc disease, herniated disc, bulging disc, back pain, neck pain, thoracic pain. So it's enough to keep us pretty busy. That said, back pain and neck pain and curing back and neck pain is our specialty. Okay, we're inside the L4-5 disc. We have an endoscopic view. You're looking at it with me. You're seeing everything I'm seeing. I'm going to go in there and grab out a piece of herniation that I see. Yeah. There's a proper way to clean a pituitary rongeur, which is what I'm using. And it's from the side, not from the top. Let him feel it. Okay. So you want to you want to pinch it from the side like that. Yeah, exactly. And you kind of shove the Raytech inside the mouth so it pulls any tissue out with it. All right. Going to bring the laser back in because I've done everything I can with the grabber. You can see there's still a lot of stuff in there. So the grabbers just don't work for this type of surgery. Everyone laughs about laser spine surgery. You don't really need a laser, but yes, you do. If your surgeon or somebody you know tells you that laser surgery or lasers are unnecessary, they honestly don't know what they're talking about. I've been doing spine surgery now 26 years, and ever since I was in medical school and residency, and actually 26 years is residency plus my time in private practice. And you know, I was taught to do big surgeries like fusions. And right when I was finishing my residency at University of Florida, we just started to use lasers in neurosurgery. And prior to that, we would not really use them. But there was a pediatric neurosurgeon, Dr. David Pincus, and he would treat cerebral kids with CP. You know, we would treat the kids with a rhizotomy. We would use a laser to do it, and it was a really interesting tool because it was basically bloodless. The laser would basically cauterize small blood vessels as we did the procedure, and the procedure with the laser was so precise that that's why we used it. So it was much more precise than, say, metal instruments like most surgeons use. So the whole concept of laughing at the use of a laser or saying it's not necessary, doesn't work, it's not true. That just is people who don't understand how the laser works. So don't listen to those people. They really don't know what they're talking about. You can also see that we do use the laser the whole surgery. We use the laser the whole surgery. It's not just a gimmick. It's a real deal. We perform true laser spine surgery here at Deuk Spine Institute. We don't just talk about lasers, we actually use them. Other places, they just talk about lasers. They don't actually use them. They use it as a gimmick to sell surgeries to people. But here, this is a true laser spine surgery. It's the most used laser in any spine surgery. If you go to Korea, where I learned how to do endoscopic surgery, or Germany, they don't use the laser. They rarely ever use the laser. It's more grabbers, like the other instrument I have, But laser is so important to fix the disc. And when I started using lasers, I found that my results got much better with patients. So I've really been using the lasers since the beginning. You know, when I started doing these surgeries 15 years ago. And the truth is that all this scarred up tissue here that you debride with the laser, you can't get it with the grabbers because it doesn't come out. It's just too stuck down. So the laser is invaluable for what's called the annular debridement. And that's the whole point, I guess, if you think about it, is if you're not doing an annular debridement, you don't need the laser, which is why we're the only ones really using the laser, because we're doing an annular debridement. And so all these other surgeons that do endoscopic surgery and don't use a laser, they're not doing an annular debridement. And we're the ones who discovered the annular debridement here at Deuk Spine. We're the first ones to do it, and the first ones in the world to publish it. And the annular debridement is the key to curing the back pain. If you don't do an annular debridement, you don't get the cure. Look at all that tissue. It's so abnormal. Pink and blue. Who likes pink and blue? Right? I do too. When my son was born, we painted his room blue, and my daughter was born, we painted her room pink. So we had pink and blue in the house.
We have a question from the app.
Sure.
It's actually about your children. Someone wants to know if any of your children are going in the same profession.
Are any of my children going to go into the same profession?
Yep.
Honestly, I've discouraged them from going into medicine for years, and I hope I don't regret that decision. But the answer is now, yes, I want them to follow my footsteps. I wasn't sure. Medicine has really taken a bad turn, namely because the insurance companies have just destroyed medicine and made it so bad. I mean, let me ask my anesthesiologist, how do you feel about medicine as a career?
Oh, I hurt my summer too.
Yeah. So let me give you an example. Here's the problem. You go through so much medical school, college, residency, you make massive sacrifices, and the whole time you're paying for your own education, like hundreds of thousands of dollars total. And then you get out and you're supposed to be, you know, compensated fairly for all the sacrifice and time that you weren't working, that you were actually paying for your education. And then you find out that you can't even make a living with the amount of money that the insurance companies are paying you, like literally. So how much do you think an anesthesiologist makes per hour? What do you think Medicare pays? And who controls Medicare rates? The Medicare rates are controlled by the private insurance companies, like Blue Cross Blue Shield, Cigna, United Healthcare, okay? They control Medicare rates because they're the Medicare administrators. They deny payments. They control the flow of money from Medicare to providers like hospitals and doctors and therapists, all right? Nursing homes. Anyone that gets Medicare payment gets it through a private insurance company that controls the purse strings, okay? What they've done is they've reduced the reimbursements to doctors over the years to where an anesthesiologist won't work for less than around $200 an hour, okay? And they shouldn't have to be honest with you. They should be paid $200, $300 an hour, maybe even more, like for more complicated cases, like cardiac cases or brain surgery, $400 an hour. What do you think Medicare pays an anesthesiologist? $90 an hour. Now you show me one anesthesiologist who will work for $90 an hour. None will work for $90 an hour, zero. But that's what they get paid by Medicare, and then the commercial insurances tag their payments onto the Medicare payment. They say, okay, well, if Medicare pays you $90 an hour, we'll pay you $90 an hour. So it's a weird game that's been going on for years. So if you're an anesthesiologist, you're getting paid $90 an hour by Medicare. Well, you can't survive on $90 an hour. I'm sorry. You can't. And that's not right to do to people who have put off working from high school, have gone to school and educated themselves so they could take care of patients for an additional, 4 and 4 is 8, plus another 4 is 12 years as an anesthesiologist. For me, 5 and 4, 9 and 7, 16 years as a neurosurgeon. Why should we get paid so little to do so much? It's really wrong. So The insurance companies are making billions of dollars a year, taking all of your money, patients' money, putting it in their pockets and getting rich. Meanwhile, they're paying doctors less and less every year. So a lot of doctors don't like that. They see that as a problem. Also, because doctors are getting paid so little, they're closing their practices and they're going and working for the hospital. So now you see a shift. It used to be 20 years ago that only 10% of doctors worked for hospitals or corporations. And 90% of them were private practice, and they were able to make it because they had enough money coming in. But because of the cuts in compensation, now doctors have given up trying to run their own practice, and now they're all working for hospitals, okay? Only 10% of doctors are independent now, okay? So you see a dramatic change in medicine and a loss of the independence that doctors have in caring for their patients. Now they have to follow the hospital's guidelines or insurance company guidelines. So you can't actually give your patient the best medication because the insurance companies deny it. They make you fill out forms. The forms are very complicated. The forms end up, after you spend all the time filling them out for the patient, they end up denying the medication still, or they end up denying the treatment or the MRI or the x-ray. So basically, the insurance companies have started practicing medicine, and that started a long time ago, and they're denying payment for treatments, and they're basically destroyed medicine, and we've allowed that to happen. We as a society have allowed that to happen. Our politicians have allowed that to happen, because it happens at a state level, the level of the state legislature. It is state laws that allow insurance companies to deny treatments and underpay providers. Some states are better than others. Florida is a really bad state. It's very favorable to Blue Cross Blue Shield, who also happens to be the Medicare administrator and the #1 private insurance company in Florida. They have more covered lives than any other carrier. So the insurance companies have basically carved up the United States into territories, and they have monopolies in those territories, and they get away with it. United Healthcare has its territories, Blue Cross Blue Shield has its, and they also control Medicare. So we are basically at their mercy. This is the tear, by the way, right here. Look at that nastiness, okay? And I've been working on the tear for a while. So it's hard to tell your children to go into such an oppressive, denigrating profession as medicine anymore. It used to be a noble profession. It used to be a wonderful profession. And now it's like being an indentured servant or slave to the insurance companies. So, yeah, it's hard to get excited about that kind of a job where you know you can help people, like this laser surgery, and yet you have to fight the insurance companies on every claim to get it covered. So, do I want my kids to go into neurosurgery? Absolutely. I want my daughter to be a neurosurgeon. I want my son to be a neurosurgeon. That would make me very happy. I want them to follow my footsteps and do this procedure when I'm long dead. So I'm hoping that happens. Will it happen? I don't know. You know how teenagers are. You can't tell them what to do. They know everything. But I'm really hoping that they do, okay? Now, my son is also a professional race car driver, but it's too early to say if he's going to make it or not. But I would rather him be a neurosurgeon than a professional race car driver. I told him that the other day. So I'm hoping that he listens. And I said, do both. You know, you could be the first Formula One driver and neurosurgeon in the world. Nobody else would have done that. You could be the first one and the only one. Because I don't think there will ever be another neurosurgeon who's a Formula One driver. So I'm trying to convince him to do that. We're hoping to get a sponsor. We've been talking to a sponsor who I think is interested, but you never know until they show you the money, right? So, Jerry Maguire, show me the money. Thank you for asking. So, to answer your question, I really do hope they do. Follow my footsteps. I know Dr. Patel's sons. He has two, Rohan and Krishna. And I think Rohan is going to go into business, and Krishna is probably going to go into medicine. So maybe Krishna will come and work here when he's done. Both of them have been working here for years as medical assistants in their summertime, you know. So what I could say is my personal opinion, if there wasn't a Deuk Spine Institute and it was just go do regular medicine and be a slave to the insurance companies, I would say no. I don't want my kids to go into medicine. But because I could see my children carrying on my work, my discovery, my treatments for patients who need it desperately around the world, I would say yes, do it. I guess that's the best answer I can give you. I don't think anyone really understands just how much the doctors' hands are tied by the insurance companies right now. And people will argue with me, and that's fine. They'll say, no, the hospitals tie your hands. But I'm telling you right now, hospitals tie doctors' hands because of the insurance companies. I've seen it. I remember, for those of you who don't know, I was the chief of staff of a hospital for 2 years in a row, elected by my fellow doctors, okay? And chief of staff is the highest position in a hospital for a doctor. It literally is the liaison with the board and the administration and all the chairmen of the surgery committees and all the other committees. You are the top dog. And that was my position for 2 years at the hospital as chief of staff, okay? So I saw everything in medicine. And believe me, I saw it happening way before the other doctors did. And I just have seen a degradation of healthcare in the United States, tremendous degradation, and it's all due to the insurance carriers, one way or the other. Okay? I'll give you an example. There's a treatment for a blocked artery, okay, in the abdomen, aortic stenosis. And for the longest time, we did open surgery, where we went in and cleaned out and put in a patch, a graft, and diverted the flow. And then they came up with this procedure that's done minimally invasive through the groin. And the surgeon and the interventionalists at the hospital all wanted to do this less invasive procedure, safe, wonderful results, no downtime, very, very good for the patients. Much better than open surgery, which is very dangerous. And the insurance company didn't want to pay for the surgery because it was more expensive than the open surgery. So guess what? They told the hospital, we're not paying. And what did the hospital do? They told the surgeon, you can't do the surgery. You can't do the less invasive procedure that's better for the patient because the insurance company won't pay for it. So the truth is the insurance companies are deciding how people are treated, and they're forcing them to have cheaper, less expensive treatments that are far worse. Like, for example, this surgery right now. The insurance companies don't want Deuk laser disc repair because everybody's going to want this treatment for their back pain. Everybody. There won't be a single person who won't. Nobody's going to want fusion. Nobody's going to want artificial disc. They're going to want this. And the insurance companies don't want to make this generally covered. So we actually have to fight claim by claim with the insurance companies. And we get it paid. Quite often, we get it paid. Not all the time, but we get it paid. And if we don't, we sue them on behalf of the patient. So we're going to make changes to the policy and coverage of these procedures, but you have to fight the insurance companies to do it. You can't just go along with what they want. You have to stand up for what's right for the patient, what's best for the patient, what's safest for the patient. But the problem is most hospitals won't do that. They're scared of the insurance companies. I'm not scared of the insurance companies. I learned a long time ago you have to fight them to get them to do what's right. And so we're used to fighting them by now. We're kind of like Israel and Palestine. You know, we're not scared of war anymore. We've had rockets and missiles fired at us. We know what kind of damage they can do. And we know we can fight back. And we could send the Apache helicopters and the tanks in. And that's what we're doing, okay? We're literally going to kick the insurance company's asses. But we can't do it alone. We need the help of the patients. So people have to have a grassroots effort. They have to rise up. They have to demand what's best for them rather than what's best for their insurance companies to get rich. That's what it comes down to, folks. So I know I'm a little off topic, but you asked about my kids, and I wanted to give you an answer that was comprehensive, that you could understand in the context of why I would not want my children to go into medicine and why I would. The would part is only because I want them to do what I do, Deuk laser disc repair, for the world, because there's no one else doing it besides me. And it needs to be done everywhere. It needs to be available in more places. So I just see that as a trend getting better and better over the years as we start winning more coverage decisions with the insurance companies. If we have to take them to court and sue them, and they're going to lose more and more, and they're going to have to start paying. Now, if you guys have never heard of artificial disc, they had to go through the same thing, okay? The artificial disc manufacturing companies, they had to sue the insurance companies, and they got victories in court, and now the insurance companies cover artificial disc. The only one that doesn't is Medicare. And I'm surprised Medicare doesn't cover it still, because I thought they would have beaten Medicare down by now. But everybody else pretty much covers artificial disc. But when artificial disc first came out in the United States around 2002, about 20 years ago, I was there for that, and we were putting artificial disc in at the university. And we weren't worried so much about insurance companies and getting them to pay, because they had a really good billing department and collections department, so they would negotiate. But we still had some insurances that wouldn't pay for it because it was a new technology. Of course, it had been around in Europe for 20 years earlier, but maybe even longer than that. But the insurance companies still didn't want to pay for it because they knew more people would want to do artificial disc. So, long story short, the court battles ensued in the years to come, and victories were had by patients who stood up for their rights to get good medical care, and they changed history by getting the insurance companies to pay for those procedures. Same thing will happen with Deuk laser disc repair. There's no doubt about it. And that's happening already. So I'm very optimistic about it, and now I want my kids to follow my footsteps. Yes. Yes, I do. All right, we're done. All right, if you have questions, feel free to type them up, and I will answer them for you. But I just want to review what we've done. We've done Deuk laser disc repair, L4-5, L5-S1, in a patient who comes to us from Texas with chronic back pain and 2 bulging discs. Remember, a bulging disc is a herniated disc, just a small one. And they came here to get rid of their back pain, which is what we do here. We cure back pain. We cure neck pain. And I expect his back pain will be completely gone. Now, I can tell you he's a repeat customer because he came here a month ago and had his neck done. He had herniated discs in his neck. And that surgery went so well for him. He's very happy. The pain is completely gone in his neck that he said, hey, by the way, I've got back pain. Can you fix that? And I said, yep, absolutely. We can fix it. So now he's here getting his back pain cured. And hopefully he'll be willing to do a video for us. And we'll be able to share his success of the procedure with you. And you'll see firsthand that the surgery works. Now notice all I did, okay, the only thing I did was make a cut in his skin and bring a tube down. I brought this tube down into the herniation, and we used the laser to clean up the tear, the annular tear, debride it, and we took the herniation out. That's all we did. Annular debridement, removal of herniation, and a skin incision. The skin incision is not going to cure his back pain. Putting the tube in through his muscles is not going to cure his back pain. It's what we did at the disc level that will. All right, let's take a look at the incision. 7 millimeters. And for those of you who saw fusion surgery, you saw how much bigger the incision is. I would put a stitch. Yeah, just because he's been on herbals and he's kind of oozy. I'm going to call our EBL 5 mil. We lost a little more than usual, which is 5 mils. Normally we lose 1 milliliter, but we lost around 5 mils today. Raytech off the field. I'm going to head over and do a quick timeout. Then I'm going to head over to our broadcast room. Why don't you run some videos for our audience, and I'll be there in a couple of minutes. Okay, Diego?
Okay.
I'm Dr. Deukmedjian, and I'm here with one of my patients who just finished having the Deuk laser disc repair, endoscopic laser-assisted repair of 2 herniated discs in his back. And we finished about an hour ago. How are you feeling?
I'm feeling great. I'm feeling much better. Yeah.
Good. And a few minutes ago we were chatting about your symptoms, and you said that you would have a Charlie horse in your leg. Tell me about that.
So, you know, after the pain that was in my leg, as I would do any morning stretch, just you wake up in the morning and you just reach and you stretch out your body, and immediately I would feel a Charlie horse pain throughout the right leg, consistently every day. And just to test it out, just to feel what that would be like, I just flexed that calf and kind of simulate that, and nothing at all.
So the leg pain is gone.
Gone.
And then what about the pain in your lower back there? Do you still have that pain?
That pain is gone.
Cured.
Yeah. Cured completely.
Awesome. I know you're a little sore from the surgery.
Yeah.
So why did you decide to do the Deuk laser disc repair as opposed to a fusion or something more invasive like that?
Well, my physician recommended me actually to send me to a place that I will not name, but to get a fusion surgery. And we looked into reviews and whatnot, and my wife, God bless her, she said, let's look elsewhere and look for places with the right kind of reviews. This was the first place that showed up with the best reviews. So we immediately had that consultation with you, and everything that you said about laser disc repair and what it would do was exactly what we wanted.
Good. Yeah, I can't tell you how many times I hear that story about the spouse saving the day and doing the research. So what's it like for your wife who has to live with you being in pain? You're such a healthy guy. You're really active in the community. You've got students. You're a musician. I mean, what's it like having to deal with, you know, seeing you and your quality of life basically robbed from the back and leg pain? What is that like for her, do you think?
That's tough because she's already a mother of 2, and just being a caretaker and having to step up and do all the things that 2 parents need to be doing at home on her own on days where I can't move or I can't function because the pain is so bad. It can be really stressful because it takes 2. And so now that we'll be able to do this together again, it's going to be amazing.
You will, but you have to let your back heal so we don't re-injure it, right?
That's correct. Yes, absolutely.
But washing dishes, no problem. You can start tomorrow.
We can fold laundry and everything. That's
Yeah,
right.
I mean, you know, one thing that chronic pain does is it literally robs people of their dignity. And I think that's the best way to say it, because human beings are social creatures, and we interact, we work together, we collaborate together, we assist each other, and we all work towards common goals. And when you're married or you have kids, you have other people dependent on you, you really, if you're in pain all the time and you can't be active, you're always psychologically you're down, physically you're down, and you don't want your kids seeing you in pain and suffering. So sometimes it's easier just to take a back seat, and that's not how you want your children remembering you.
Right.
So back pain's a deep thing. A lot of people don't understand it. They just think it's pain on the surface, but it really goes deep into interpersonal relationships and dignity.
Absolutely. Yeah, one of the best advice I ever got was it's not always 50-50, and sometimes it stretches in your marriage, that 84, 80-20 and whatnot, and back and forth. And for the next year, it's going to be leaning heavily on my wife, but I know that after that, I'm going to be able to get on the floor with my boys. I'm going to be able to throw the ball around with them, and I'm going to be able to take them to wherever they want to go and play at the park with them, and I can't wait.
Good for you.
Yeah.
So tell me just a little bit about your being a musician, and what are you looking forward to being able to do? Don't say lift the piano, whatever you do, okay?
Right.
Because we know that's how all this started 6 years ago.
Yes.
But what are you looking forward to? How did this pain affect your job, your passion, your love for music?
I'm on my feet sometimes 12 to 14 hours at a day, and within a few hours of just being on my feet, I can feel that pain. And knowing that I can go through a full day and being able to function properly, being able to pick up my saxophone and play comfortably without having to worry about any pain, it means the world to me.
Yeah, it
means
sure
the world.
does. I mean, as a musician, you're totally focused on playing that piece. You put everything into it. You got the music going. You got to keep up. You have the right tempo, the rhythm, and pain can be a massive distraction, right?
I have an anecdote of that. I mean, I'm sitting in a rehearsal playing and having to make sure that my brain becomes more focused on how I was sitting constantly to keep the pain away so I could play.
All right, is that better? Hopefully you guys are not getting any weird feedback, but this patient has, as you can see in the bottom corner of this broadcast, there's a laser repairing the disc herniation and the annular tear. That's what we did to two discs, the L4-5 and L5-S1. It started out in the beginning of surgery, we placed some needles. Those are called spinal needles. They go into the spine. Specifically, they went down to the herniated disc, and then we brought the endoscope in, which is what you're watching now. And you can see the laser fiber here zapping away at the annular tear. What's an annular tear? Well, there's a wall around the disc that holds the jelly in. It's called the annulus fibrosus, okay? And so if you look here, you can actually see that there is a protrusion there. That red thing is actually jelly from the center that is squeezed out through a tear. And so that tear in the annulus or wall that holds the jelly in normally is the reason why there's a herniation. If there wasn't a tear, there wouldn't be a herniation. And when I say herniation, I'm talking about disc protrusion, bulge, extrusion, any of the names that you commonly see on MRI reports that refer to the jelly in the center of the disc pushing out through a tear. And it is the jelly that's stuck inside the tear that actually causes the back pain because it creates inflammation within the tear, and that's what we're removing here with the laser. So you can see the laser going to work, removing all the torn annulus and what's called interposed nuclear material and inflammation. So it's really it. I mean, what you're seeing here is a 0.5 millimeter laser, and from side to side in the tube it's 6 millimeters. So think about what 6 millimeters is. It's that big. So this is really a Band-Aid incision endoscopic spine surgery. It's only found here in Orlando, Florida at the Deuk Spine Institute. All right, let's go to our first question. Dr. Patel's sons, he has two, Rohan and Krishna. And I think
Are MRI findings accurate in determining herniated discs and related sciatica?
Okay, great question from one of our viewers. I love this question. So the question is, are MRI findings accurate when it comes to herniated discs and determining sciatica? This is like, to me, the platinum question of the day. Great question. I can't tell you what a big issue this is. This is a huge issue. So here's the problem. MRI scans are pictures, okay? And what happens is a human being looks at those pictures, and that human being's called a radiologist. And, you know, I got to be honest with you folks, radiologists were not the A students in med school. They're usually the B, C, and D students, usually down closer to the C and D. All right, so what I'm getting at is these are people who, for the most part, underachievers in medicine, and they don't like people, okay? So to be a radiologist, you can't like people. You basically lock yourself into a dark room all day looking at pictures. And for the doctors that actually like people, you become what's called a clinician, where you actually see people and interact with them and help them, like me, all right, where I see people every day. So I'm painting a picture about radiologists. It's a generalization, I get it, but you need to know the truth. Most radiologists are not nice, friendly, loving people. They are not empathetic people. So they're the kind of people that like to be in a dark room looking at pictures all day. Think about that. Mental image. Now, they're also usually the bottom of the class, okay? And many of them don't make good clinicians, okay? I'm going to make some enemies, I get it, but you all, you know, that's what we're here for, is the truth. So their perceptive skills, their diagnostic skills, their observational skills are not great. And they're the ones reading those MRI reports, or MRI images, and creating the reports. So how do I mean, do I really feel this way about radiologists? 100%. All right, one of my best friends, he's an ENT doctor. His wife has breast cancer. She was misdiagnosed by the radiologist. Big old breast cancer right there. Has been there for a couple of years. Looking back at the films, the radiologist missed it every time. Just piss poor, sloppy work. And I can't tell you how many radiologists are like that. They're arrogant. They don't think there's anything wrong with what they do, and yet they miss stuff all the time. So I know this is a long-winded answer to your question, but it is a truthful answer. You cannot trust the radiology report. Now, 1 in 10, maybe 1 in 20 radiologists are actually good and take pride in their work, and they're going to talk about everything abnormal in that MRI. But I've had radiologists where I've literally sent the patient for an MRI of the lumbar spine. It had an obvious herniation on the MRI. You can see it, giant. And the radiologist read it as normal. And I called the radiologist and said, I think there's a herniation at L4-5. That's why the patient has back and leg pain. It's on the right side. I can see it. His response to me was, you're right. There's a herniation there, but it's not that big, so I didn't call it. Because if I had put it in the report, then the surgeons would want to operate on it. That was his answer. So here's a patient with a herniated disc, back and leg pain, as a result, where the radiologist decided, for his own reason, not to name the herniation and put it in the report, but just to say it's normal. Why? Because he thought it was small and it wouldn't cause symptoms.
Disc herniations are a common cause of chronic back pain.
You are not a clinician. You have no concept of disease connection to MRI findings. That's the clinician's job. Your job is to report structural abnormalities. And they couldn't even do that right. And so I'm telling you, radiologists have bias. They think they know more than the clinicians do. They don't like people, and they sit in dark rooms all day looking at pictures.
Skin incision is
so do not trust your MRI report. Get a second opinion. The person you can trust with your MRI report is a good surgeon. Surgeons know what's wrong and what's right and what's normal and not normal, okay? And if you have any doubt, send your MRI to the Deuk Spine Institute. We do free MRI review for you. We're going to look at your report, but more importantly, we're going to look at your images. Okay, we're going to look at all the images and figure out what's wrong. And I will tell you what's wrong. It doesn't take me long to figure it out. I can literally figure it out in about a minute per patient. Okay, so when we get these MRI reviews that come in, I personally look
If
at
you have a
them.
herniated
I
or
figure out what's
bulging
wrong.
disc and back
We get
pain,
you on the
submit
phone.
your-
We set up a video conference. We do a 10, 15-minute video conference, and I show you what's wrong and what needs to be Explain done what to we
Oh,
fix do the in problem. here, It is free. endoscopically to
Oh,
repair
uh,
the
uh,
Why not take disc. advantage of it, folks? We're It's now free, taking this for tooth God's out. sakes. Don't Remember, go to this is the tooth Facebook that and was expect at people to diagnose you with one image of your MRI. I get people all the time putting up an MRI picture, one picture, and it's like, that's like looking at one little place on your spine. We need to see from left to right, from up to down. We need to see the whole thing. So I need all the images uploaded to make an accurate diagnosis. People will miss things. You will miss the herniations. You may see one here, but you're missing the one down here. The one up here is on the right, the one down here is on the left. If you only get a picture on the right side of the spine, you're only going to see the right side herniation. You're going to miss the left side. So we need to see the whole DICOM set of images, about 100 images per MRI. We want them all uploaded with your CD, or just send your CD in, and we'll be happy to do the MRI review for free. All right. So what did we just do? We just proved that those two discs that I'm fixing are causing his back pain, the typical pain he gets. Yeah. So the question is from Facebook. 8 out of 10. We have one of our viewers asking, Dr. Deuk, is the straight leg raise test useful in determining impingement of the nerve root? This is another great question. The answer is no. I mean, that's what we're all taught, you know, in residency and medical school, straight leg raise. Yeah, that'll tell you if you have a pinched nerve. But I'm telling you, for every 50 nerves that are irritated by the herniation or pinched by the herniation, the straight leg raise will be positive in like 1 out of 50. All right, but all 50 patients would benefit from treatment of that herniated or bulging disc. You fix the disc problem, the leg pain goes away. So the answer is no. The straight leg raise, in my opinion, is useless. I only do it to make the insurance companies happy because they have doctors reviewing the, you know, the clinic note, and if it's positive, I put it on there. If it's negative, I put it on there as well, negative. But it's useless. What really matters, if you want to help people that have back pain and leg pain, is the physical exam is the most important thing, but it's basically real simple. If somebody has pain shooting from their back down their leg, it is almost always a pinched nerve in their spine, right where the disc is. It's a bulging disc or a herniated disc causing it. Okay? The second most common reason is a piriformis syndrome, where the patient will have a torn piriformis muscle in their butt cheek, and they will have horrible pain and tenderness in the top of the butt cheek on that side. And when you push on that muscle at the top of the butt cheek with your fingers and push right in that one spot where the tear is, they will go, oh, it hurts so bad. So they'll have pain in their butt cheek on the muscle, and it can also cause that pain in the sciatic nerve to shoot down the leg, because the sciatic nerve runs through the piriformis muscle or underneath the piriformis muscle. Therefore, piriformis muscle injuries will actually cause sciatic pain as well. That's the second most common cause of sciatic pain. The first being a pinched nerve where the herniated disc is, okay? So number one cause of sciatica or leg pain is that right there. A herniated disc in the foramen, pinching the nerve root that goes down the leg. All right? Very, very common problem and very easy to fix with the laser surgery you just watched.
Are dehydrated discs more prone to trauma injury as like a motor vehicle accident?
So great question. Somebody's saying, if I've got a dehydrated disc, like a degenerated dehydrated disc, is that going to be more prone to injury than I assume a regular disc? And the answer is, I don't know. Honestly, I don't know. I've never really looked at that. I don't think there's anybody that studied it before and published on it, so I don't think there's anything in the literature. But if I think about it, okay, if you have a perfectly normal disc and you get in a motor vehicle accident, I think that you're less likely with a normal disc at the start of the motor vehicle accident, you're less likely to have a herniation and problems from the disc because you have a normal disc. So that normal disc will absorb some of the energy or the impact, and it may cause some tearing. But if you have a dehydrated disc that's already damaged, there's already going to be an annular tear there. Is that more susceptible to injury? Probably, is what I would have to guess, but I don't know for sure. I would have to guess probably.
They were also asking
The next question is, can an MRI tell if the disc is dehydrated? Absolutely. You can see a dehydrated disc on an MRI. On what's called the T2 weighted images, where the spinal fluid is white, the disc itself should be bright white normally, and if it's dark, that means it's drying out, it's dehydrated. Remember, dehydrated disc, degenerated disc, all start with an annular tear. The annular tear is the key. It is the first injury to the disc. It is the beginning of everything that's part of what's called the degenerative cascade of the disc, where the disc herniates or bulges, where the disc dries out. That drying out of the disc, folks, is actually a result of inflammation, okay? So when you get an annular tear and the nucleus squeezes in there and it creates inflammation in the annular tear, that inflammatory juice goes back into the disc and starts to dry out the disc. If you go in and fix the tear with the laser that we just did, get rid of the herniation, repair the tear, debride it, it allows the tear to seal off and heal. It stops the inflammation. It stops the inflammation, the disc will stop degenerating. That was our last question. A really good surgery. We have a 3-level surgery up next. It's going to be a left L3-4, right L4-5, L5-S1. No, the 5-level is last. Yeah. Our last patient is a Canadian. He's a 5-level. So he's a bilateral 3-4, bilateral 5-1, and a right-sided 4-5. So he's got herniations on both sides at L3-4 with bilateral leg pain. He's got herniations at both sides at L5-S1 with bilateral leg pain. And he's got a right-sided herniation at 4-5. So that will be our third case of the day. But the next one is just a 3-level.